IV fluids. We will be discussing the main categories of IV fluids. Training objectives. At the end of the video, you will be able to list the categories of IV fluids and several examples of each. We will be able to describe the constituents of common IV fluids, and the main categories of IV fluids are crystalloid and colloid solution. Crystalloid fluid, these are electrolyte solutions that have a relatively low tendency to stay intravascular. Common examples include normal saline, 1/2 normal saline, which literally has a concentration of 50% of that normal saline. There is a commonly used maintenance fluid D5 1/2 normal saline plus 20 milliequivalents per liter potassium chloride, and there is also some complex solution, the lactated Ringer solution. Next is the colloid, which has a relatively high tendency to stay intravascular. Examples include the natural albumin, fresh frozen plasma. There is also synthetic solution, the dextran and hydroxyl ethyl starch. To understand the different types of crystalloids, we need to know first what is the normal plasma. Remember that plasma is the extracellular liquid portion in which the red blood cells, white blood cells, and platelets are carried. When it comes to IV fluids, the most relevant constituents of plasma are the following: sodium, which is normally 140 milliequivalents per liter, chloride, which is normally 100 milliequivalents per liter, potassium at around 4 milliequivalents per liter, calcium at around 2.4 milliequivalents per liter, and glucose at about 0.85 gram per deciliter. Plasma also has an important anionic buffer to help maintain pH at a physiologic range. That buffer is bicarbonate at around 24 milliequivalents per liter. And with all the osmotic constituents of plasma added together, including others that are not listed here, gives a total osmolarity of 290 milliosmoles per liter. When talking about IV fluids in comparison to normal plasma, we also need to discuss their tonicity relative to plasma and typical indications which are not relevant here. Next IV fluid is 0.9% saline, frequently referred to as normal saline or NS for short. The 0.9% refers to the fact that it is composed of 9 grams of sodium chloride dissolved in 1 liter of water. With a little bit of high school chemistry, you could work out that 0.9% saline must have in 154 milliequivalents per liter of sodium and 154 milliequivalents per liter of chloride. There is no potassium, no calcium, no glucose, and no buffer. The predictive osmolarity of normal saline is 308, which is given in units of milliosmoles per liter. Normal saline is usually referred to as an isotonic, meaning that when infused, it has no effect on intracellular volume because its effective osmolarity is the same as within the cells. Occasionally, 308 is higher than 290, so normal saline is actually slightly hypertonic and the quotation mark is isotonic. The typical indication of normal saline is resuscitation. In other words, replacement of volume in a patient who is hypovolemic from sepsis, hemorrhage. Next is the 0.45% saline, or simply called 1/2 normal saline. It has 77 milliequivalents per liter of sodium and chloride, and a predictive osmolarity of 154 is substantially lower than 290 milliosmoles per liter of plasma. So this is hypotonic fluid. Hypotonic fluid can induce hemolysis as well as rapid and dangerous drops in plasma osmolarity. Therefore, half normal saline is not used for quick resuscitation but rather for maintenance. Maintenance fluids are those used to replace ongoing physiologic losses such as urine production roughly in real. Next crystalloid is D5W, which is electrolyte-free sugar water. The name D5W is short for 5% dextrose water, where dextrose is another name for glucose. So this is composed of 50 grams of glucose dissolved in 1 liter of water. The calculated osmolarity is 252 milliosmoles per liter, which is hypotonic, It is not used as a maintenance fluid since none of it stays in intravascular space. Instead, it is used solely in hypernatremia, which one is trying to bring down plasma osmolarity, and in persistent. We have our final fluid, the lactated Ringer solution, also known as Hartmann solution, 130 milliequivalents per liter of sodium, 109 milliequivalents per liter of chloride, 4 of potassium, and 3 of calcium. There is no glucose. The most interesting aspect of LR is the inclusion of an ionic metabolizer buffer, the lactate, which is present at a concentration of 28 milliequivalents per liter. The overall osmolarity of LR is 273 milliosmoles per liter, which makes this an isotonic fluid, and its major use is for resuscitation, with less frequent use as maintenance fluid. So what are some of the downsides of crystalloid fluids? Large volumes of normal saline can lead to a normal anion gap metabolic acidosis. LR is relatively contraindicated in hyperkalemia and concurrent blood transfusion.